Published last of August last year, there has been a tremendous addition of new studies, and even more appalling and shocking to the scientific community. Again, just the tip of the iceberg in this case. For instance, cell phone use decreased the semen quality in men by decreasing sperm count, motility, viability, and normal morphology. Men and women, do you think this is good? Do you want this really? And I think I have the answer. Exposure to pregnant women to mobile phones significantly increased fetal and neonatal heart rate and significantly decreased the cardiac output. That means in normal layman terms that the baby was stressed. Do you want to have stressed babies or stressed fetuses? I don't think so. This is a PhD thesis from Belgium, recently released to the public arena, and this person, Dirk Adam, he showed that in a mortality study that all the exposed groups show survival rates, mean survival rate of non-treated animals of the same age. In layman terms, a mobile phone or a Wi-Fi system and their microwaves will kill you. And it's a significant result. There has been a link to breast cancer in women, and people thought that the microwaves would actually cause breast cancer. Maybe they do not, but what they actually do is that they impair or reduce the efficiency of the clinical treatment using a drug called tamoxifen. So you get the breast cancer, then the treatment will fail, and when it fails, you die. And I ask men, although it's rare, is this good for you? I hardly think so. Another study, and this is so interesting, because sometimes you hear that people just imagine and listen to radio and television, and then they start to sense things in their body which they would connect them to the electromagnetic fields. But these are tomato plants. And they don't listen to BBC, they don't watch TV, or if they would be in a classroom with Wi-Fi, they would react, as you see here, with a wound response. And the scientists from France in this article, they even wrote that the response at the cellular level was the plant. That's the reaction. So you have to remember, when you buy flowers and cut them, for instance, they do react, you know. So think about that, you know, they are alive. And of course, to transfer these data to kids in schools with Wi-Fi, that's not very hard. And you can start wondering, is it really good to expose them 24 hours around the clock, wherever they are? Very recently, I'm sorry for the quality of the left-hand side, but the right-hand side, this very big Interphone study has released yet another report, and now they are saying that mobile phones do increase the risk of brain cancer. The chances of developing a malignant tumor are significant more than 10 years. And you know, kids, they will be exposed from Wi-Fi, mobile phones, computers, and so on, more or less before they're even born even. So they will have a lifetime exposure, and the question is, how many of them would actually have died long before that? Because these tumors are really not treatable. You will die, and the median lifetime average after the clinical diagnosis is less than 2 years. So when the doctor says, start writing your will, because the time is short. And it's interesting that a study chief, Professor Elizabeth Cardix, she said like 1 year ago or 2 years ago, there is no risk. But now she says, others, like this scientist in working at the Center for Pain Treatment and Rehabilitation in Lake Forest, Illinois, United States, in surgical neurology, that cell phones are more dangerous than cigarettes. And I guess you don't allow your kids in school to sit smoking during the lessons, do you? The European Parliament, under which we all have to function,